COVID-19. Why lots of healthcare and frontline workers refuse the vaccines. The world needs many vaccines to effectively control the COVID-19 pandemic, especially with a rampaging new strain. While health groups support vaccination, many healthcare workers are hesitant to get the jabs. They are hesitant because of potential side effects and lack of faith in the government. On December 15, 2020, the Kaiser Family Foundation published a new survey of the public's interest in getting COVID-19 vaccines in the US. About 27% of the public would probably or definitely not get any COVID-19 vaccines, whether free or deemed safe by scientists. Vaccine hesitancy was highest among Republicans at 42%, adults aged 30 to 49 years at 36%, and rural residents at 35%. But there's a surprise in the survey. Around 29% of those working in the healthcare sector were hesitant. The greatest concerning reason was possible side effects at 59%. Severe reactions from mRNA vaccines have been reported, particularly in those who had a history of severe allergies. The lack of trust in the government to ensure the vaccines are safe came next at 55%. With so many things that happened in the past, added to transparent issues, the public became suspicious of COVID-19 vaccines. Most people probably wondered why the vaccines were done in less than a year. What they didn't know was the vaccines were repurposed vaccine designs, supposedly made for SARS and MERS. Another reason was the vaccine being new at 53%. There are several unknowns because the vaccines weren't tested in real-world conditions. Dr. Nikhila Juvadi at Chicago's Loretto Hospital told NPR, "There's no transparency between pharmaceutical companies or research companies or the government sometimes." Dr. Juvadi referred to the African American and Latino populations. These populations have no idea how many people from their communities took part in the research. Without that detail, they are unable to trust the vaccine's safety and effectiveness. Also, they encountered the term guinea pig, which raised their mistrust further. According to Forbes, only fewer than 50% of hospital workers at St. Elizabeth Community Hospital in California were willing to get vaccinated, while about 50% of frontline workers in Los Angeles refused the vaccines. The county had to figure out how to reallocate these doses to avoid waste. The world needs to find a way to move past these hurdles to fight the pandemic and the new coronavirus variant.